a therapeutic homeostasis kind of system, which brings you back into balance. Very similar to what happens in acupuncture. And then the other is the prevention health maintenance system, which keeps the body retuned, and on a day-to-day basis, with using it twice a day, you undo a lot of the damage that we do to ourselves throughout the day, particularly as we get older. Once you get over about 40, it seems that our normal day-to-day wear and tear, which is sort of like Chinese water torture, is cumulative. And if you could do something to mitigate that by regular health maintenance, i.e. 8 minutes twice a day on a QRS, you can reduce, decrease, and sometimes even stop that kind of aging response. Yes.
I'm interested in the possibility of inducing a relaxation response that affects the parasympathetic nervous system. Could you comment on that?
Yeah, one of the things, again, the QRS has been found to do very, very early on in anybody with any kind of a chronic condition, particularly if you have chronic pain. There's usually anxiety associated with it, usually some level of sleep disorder associated with it. And the QRS very, very quickly, within days, significantly improves sleep, significantly reduces anxiety. We have not done any studies specifically with galvanic skin response or, as I mentioned, ACTH levels. And the level of increase in serotonin just from a static magnet over an acupuncture point was about about half that you saw with Prozac. So relaxation response is definitely something that we see. We just haven't done any systematic studies to quantify it. But I think you can take that to the bank, that's one of the benefits you get. I'd like to ask everybody on the line, if you are not asking questions, press star. If you press star to get on, then press star to get back off, so you could mute your phone, unless you have a mute button on your phone, because we have a lot of background noise, and it's hard to hear people with the background noise.
Excuse me, Dr. Pollack, it's star 6 star. To self-mute yourself, star 6 star.
Okay, Christina, thank you for that. Star 6 star, that mutes your phone, unless you have a mute button on your phone.
Quantron resonance systems.com.
And then when you ask a question, you have to unmute yourself to ask your question.
Is it the same thing? Star 6 star will unmute it?
Yes.
Okay. Are we ready for another question?
We sure are.
Okay, this is Diane Deagle in Minneapolis. I'm an acupuncturist. And hi. I have a question. One of the first benefits that you cited for the use of the QRS is accelerated healing of fractures, and you mentioned various kinds of fractures. I'm wondering about pathologic fractures over such a foundation as bone cancer.
Yes, we actually I've seen some radiographs of people who have had radiation therapy, and they get osteoradio necrosis. The bone literally melts away from the radiation. We have actually seen in the studies, I've seen several of those studies, where the magnetic fields cause the bone to regrow, even in that environment, in the environment of radiation damage. So yes, along with chemotherapy, along with radiation therapy, and with pathologic fractures, you can definitely cause healing. Now, if the pathologic fracture has a tumor in it, and it's on a weight-bearing surface, I don't know that I would rely on the QRS to solve that problem for you, because it could take quite a while. In the osteoradionecrosis, it could take 3 to 6 months. The FDA-approved bone healing devices that were approved for delayed unions of bone and for fusion, with 12 hours a day of therapy, can take 3 to 6 months to heal. So again, it can work. You just have to understand that it's going to take a while, and people have to understand you're not going to have a miracle overnight.
Right. Okay, thank you.
Have you used the QRS?
Me?
Yes.
I just got mine yesterday.
Oh, okay. So you don't have any good stories to tell us about acupuncture and QRS?
Not yet, but I hope to rack them up real soon.
I hope so too.
QuantronResonanceSystems.com.
Any other questions?
Dr. Paul?
Yes.
This is Ed Mast in California.
Yes. Hello again.
I'm one of the had the shingles.
Yes.
And I just want to say that, as far as the severe pain, I mean, that was tremendously reduced, and within several weeks, I didn't have any pain. Would you care to comment on the use of the pen, or
just the pen device?
yes?
The pen tends to produce a field that is, how can I describe it? It may be like the penumbra of a comet. If you will, you can take a look at it in terms of a good thick pen. The tip of the pen lights, but the barrel of the pen goes up, flares up behind that tip. Cut that barrel in half somewhere along the way, then the magnetic field coming out of the pen looks like that, pen looking backwards at it from the tip to the barrel. That's what the field looks like. So if you think about it, then how would you use that kind of field? It has a width of maybe 1 inch to 2 inches. Now, farther away from the pen, maybe 6 inches, 8 inches, 10 inches away from the pen, the field is much wider. But like any other magnet, at that distance, that field is going to be extremely weak. The way I would tend to use the pen is I would consider using it on acupuncture points, on meridians, on very localized problems where all you want is a very specific local therapy. I typically recommend local therapies on the background.
You are entering the conference room. You are the moderator.
And then you can apply the pen to very specific problems. If you're a dentist, the pen would be excellent in a lot of dental applications. If you have specific local dermatological lesions that you're working with, that could be very helpful. If you have a lot of arthritis of the fingers, specific joints of the hand, then the pillow or the pen could be helpful with that very local discrete therapy. The pen is stronger, the field is stronger at the tip of the pen than it is, it's about the same strength as the foot end of the mat and as the pillow. Okay, the head end of the mat and most of the other part of the mat is significantly weaker than the foot, and it can decrease it by a factor of 10 from the foot to the head. The major benefit of the mat, the mattress, is that it provides a whole body treatment. So you can get away with a much weaker signal when you're exposing that much of the body to a magnetic field. When you have such a very local, discrete area of therapy, you need a stronger field. So you need the strongest field you can generate, and that field is generated by the generator, the control unit of the system. And the amount of coils of the magnetic field, the amount of energy coming to the pen. So I would use it for very local, very discrete therapies. For example, there was a lady the other day I spoke to who has diabetic retinopathy. So you can think about it, say, for glaucoma or dry macular degeneration or corneal lesions, lesions of the eyes, the retina, maybe retinal tears as well. You can angulate, or you can put the pen at a 90-degree angle to the side of the temple, right behind the eye, right behind the bone at the temple, lateral to the eye. So if you look at the eye, at that point, even over the bone, you're getting right into the back of the eye where you want the magnetic field to be maximized. So depending on what you're treating, you could use the pen and orient it to the tissues that you're trying to get at. Those are the primary benefits that I see for the pen. You could conceive of using it. I don't mean to offend anybody here. You could conceive of using it for vaginal lesions. You could conceive of using it by wrapping it in a baggie or even a condom and inserting it into the vagina to treat cervicitis.
Quantron resonance
In our book,
systems.com.
actually, some of the gynecologic studies